Okay, this video is called How to Fix Healthcare. And I'm just going to try to make a point. It's really about helping you to think about healthcare, how it works, and what you can do to help yourself. And just some of the questions will make things obvious. Is it easy to change another person? No, it's real difficult to change another person. So how are you going to change some big system that's a million times bigger than that? Is it easy to change yourself? It's doable, but it takes effort. You can change yourself, and that's what you should focus on, because imagine you had a multi-billion-dollar business. Would you want to change it? No, of course not. So that's what healthcare is. It's a multi-billion-dollar business, and the person's high up in the food chain who profit from it, they don't want to change anything, and it's not going to change. Don't waste your time or effort thinking it's ever going to change. That's an absolute waste of time. The big money comes from selling drugs, and to some extent selling procedures and devices and diagnostic tests, but especially from selling drugs. And so it's always going to revolve around that. That's where the big research money is. And the research doctors and scientists, trying to come up with a drug that'll be marketable, that's like winning the lottery, and that's where all the focus is. So basic research is not going to get done. It's just a fact. So then what's the good news here? The good news is that the hospitals are actually great at doing the things you need them to do. They're great at taking care of trauma. They're great at taking care of acute infections and stuff like that. So you need them for that. You should go to them if you have those types of problems, acute problems in particular. They're also great at taking end-stage problems. Sometimes people just from bad luck, they'll end up with kidney failure or something like that, and they're good at taking that. They're great at taking care of that kind of stuff. But here's kind of another key point of this talk, is that most disease, it's at least 70%. And a lot of people, McDougall, it's probably more like around 80% of disease. It's just the result of what you eat and what you drink, So avoid bad food, avoid toxins, and you have to learn this stuff. And what creates winners, like winning the game of health, no meat, not one bite, no oil, not one drop, okay? And don't be flexible on it. You can't be flexible on this. This is something, it's a difference between being healthy or aging poorly. Your doctor doesn't feed you. It's up to you. You have to take care of yourself, and you have to learn a little bit. Just spend a couple months watching these videos. Watch. The best teachers are going to be McDougall, Esselstyn, Colin Campbell, myself, and there's a few others that are pretty good. So there's other ones out there you got to be careful about. They'll tell you a couple good things, but then they'll try to trick you and get you to have olive oil or some other stuff that's really bad for you. No oil, not one drop. The reason why I like Esselstyn and McDougall is because their patients get better. And by the way, I was just reading McDougall. He wrote an essay recently talking about his own diet, and it was talking about some other disease as well. But the point is, he mentioned that when a person really follows his diet in every way, they're eating only about 7% fat. Now, that's extraordinarily low, 7% fat. Usually you'll hear 80-10-10 quoted for 100% low-fat vegans. So, that's what I'm trying to say. That low fat, that's a major part of really optimizing health. All right. First line therapy for chronic dietary and toxin diseases is to avoid the toxins and optimize the diet. Only after you've done that do you need to add on the medications and the surgeries. And if you do that, you'll probably never need to take any meds or any surgeries. But if you don't, if you keep everything in moderation, all that kind of stuff, or a little bit of meat here and there, you're probably going to end up with a bunch of pills and with a bunch of surgeries. Okay, surgery's no fun. I love eating the vegan diet. I don't want any surgeries. So anyways, hopefully that idea of the medical system is great for acute problems and end-stage problems. That's what you need it for. But for the other stuff, that's your own business, your chronic disease, most of it. There's exceptions, of course, but that's the main thing to get. So, like, let's say, what if I got diagnosed with diabetes? Well, I would immediately be low-fat vegan. Well, I'm already low-fat vegan. Let's say I was diagnosed with cancer. I would immediately be low-fat vegan. Well, I'm already low-fat vegan. What if I was told my PSA was high? Well, I wouldn't get a PSI, and I would go low-fat vegan. So I'm just going to go low-fat vegan anyway. Should I get a cardiac C? Well, what if I had positive scan? I would go low-fat vegan. Well, I'm already low-fat vegan, and I exercise, and I sleep, and I stress manage. So you get the point is if you're doing all that, I don't need to check for any of those things because I know I'm good. And I know I'm doing what I would do anyways, so why check? And that frees you up from needing to be worried about stuff. I don't even need to check. I know my diet hasn't changed from when my total cholesterol was 93 about a year ago. So I'm not worried about my cholesterol. That's not my problem. I'm not going to ever have a problem or die from atherosclerosis, So anyways, hope that helps.